Good afternoon. I see that it's 12 o'clock, so we will get started. Thanks to all of you who are getting on the monthly Zoom call with us at the Division of Child Care. We do have a lot of information to share. You'll see on the very first slide that we have training for minimum licensing. This is really just to help providers that are struggling with compliance or may be new to the field and just need intent training. That's to make sure you understand what the intent of the licensing regulations are. And then as well, we have monthly background check or regulatory check training for anyone who has new staff or anyone new to doing the regulatory checks, since it's all automated. So those are, one is scheduled, the licensing intent training is August 18th from 6:30 to 8:30, and monthly background check training is the 25th from 12 to 1. I've had quite a few questions and calls about COVID. We've had a surge in the past few weeks, and we have had some programs that have had to close or have made that choice. Just as a reminder, the Division of Child Care does not have any required guidance that's COVID specific. I would refer you to section 1100, 1101 of your licensing regulations, where it clearly lays out children who are sick or staff who are sick that have to be excluded from the building. So that should help guide you with any type of COVID thing. For example, if you know someone has COVID, then you would exclude them because it is a contagious disease. If you do not know and they don't have any symptoms, then that's not your fault. And people are moving around, especially those of us who are vaccinated. Sadly, some people have it and don't know about it. I just would encourage you to make sure that your staff know if they are sick, you don't want them spreading it in your building. And this variant, according to health officials, is very, very contagious, really more contagious than I think any previous variant. So, be aware of that. It could have an impact on your business if you aren't paying attention. But, you can refer to the CDC, the Centers for Disease Control also has guidance. But our licensing regs, section 1100, 1101, should provide you with guidance. If you have a question or need help, our licensing staff are available to help you. If you want to shoot us any questions, you can send an email, and I'll put my email in the box, and we'll staff it and try to help you with anything. We do still have funding for cleaning, deep cleaning, if you have to close your building or a classroom and need to deep clean. You can send it to deepcleaning@dhs.arkansas.gov. Staff, if I have that wrong, drop that in the chat box and make sure that providers have that deep cleaning email so that they can access those funds if they have a positive case and need to clean their classrooms and or their building. I have real exciting news about essential worker. My team has been working we've been trying to review and analyze the essential workers that are keyed currently through August 31st. Those are individuals that are essential to helping us as we work through the pandemic. But, healthcare workers, early education teachers, people who are in the sanitation field, the food supply chain. It covers a lot of categories of employees around the state. We're serving about a little over 17,000 families right now. We are going to be able to extend those for the last and final time. This will use up all of the funds that we have available to us until December 31st. So for those of you who have essential child care vouchers, those we will start extending unless we hear from a family that does not need it. We will extend those through December 31st. So thanks to the family support team for all their work in this effort. Thanks to the finance staff here at DHS and to our IT folks who have really been looking at this data and trying to help us make really good decisions about the remaining amount of funding that's available. So it will take us through December 31st. We will not be adding any new families unless there is a baby to an existing family. I think we have had some babies that have been born to existing families, but we're not taking new apps. We stopped taking those back, I think at the 1st of June, but this will take us through the end of the year, and we do not have any other funds So please make sure your families know that. Please make sure that you let them know that now would be a good time to save money since they're not maybe paying the full amount for childcare, and putting that back for January when there will not be any essential worker funding available and they will have to start paying again. So please help us make sure they understand that. But this will be the last and final. That funding will be completely utilized at the end of the year. I know that, just so you all know, and I know we're going to have some discussion about the new enterprise licensing system. And while it's really exciting and we're in the throes of the first week for the staff who are on from childcare licensing, you know, we're in the transition to a new system. But I will tell you, we are having families, or we're having difficulty with the billing for childcare. So the systems all coordinate with one another. And for some reason, the new system is throwing some billing problems, and we have had to temporarily suspend billing. That is temporarily suspended as of today. We're hoping it will just be 24 hours and we'll be able to open billing back up. It does appear that the current situation is specific to Benton and Washington County only. So if you billed in the last 24 hours in Benton, Washington County, I think the rates, there may be something wrong with the rates. It does appear to be isolated to those two counties, but we have asked them to suspend. I don't want to get a lot of overpayments or underpayments, and trying to reconcile those in those two counties is where it appears to be a problem now. So just know that if you're a provider and you're trying to bill today, the system is down temporarily until we can get a handle on what's causing this problem with the rates, because I want you to get paid the correct rate and not the incorrect rate. And that appears to be what's happening, at least in those two counties. Tom asked me to remind those programs who have not reached Better Beginning Level 2, those will not be extended. So let me clarify that for essential worker vouchers. Those that are not meeting Level 2, we will not be extending at your sites. I mean, that's the agreement we've had is all along, that we were going to get these programs over that hump that we're federally required to do in our state plan. So for those programs that do not meet Better Beginnings Level 2, and thank you all. I think we have several hundred programs who have achieved Level 2 in a pretty short window. So thank you to all of you who have worked really hard, and many of you are still trying, and you do have through the end of the month. And I know that many of you have accomplished that. So, but we will not extend past August 31st on those cases. So I think that is it for me, and we'll be shifting, I believe. We have my colleague, Sharonda Love, who works for Children's Hospital, who's going to talk to us about immunizations. Becky, can you make sure that Sharonda has access? I'm sure we already have it set up for her, but Sharonda, you have the mic.
Well, thank you so much, Tanya, for the opportunity, and thank you all for taking just a moment out of your agenda to learn a little bit more about an opportunity that we have with Arkansas Children's. So we do what's called a community health needs assessment, where we work with parents, patient families, and other stakeholders to assess every 3 years the needs within our state. And one of the primary needs identified is childhood immunizations. And what we also know is with the pandemic, there has been a decrease in childhood immunizations. And so I am going to see if I can share my screen. It says it will stop from the screen sharing here. And so as you can see in the western portion of our state, we have a lower increase or uptake of vaccinations, specifically in the ages of 19 to 35 months. And so targeting at your specific age group within childcare. And what we would like to be able to do is provide an opportunity for a partnership where Arkansas Children's can offer to come to daycares and provide childhood vaccinations. We also know that within this area, we're looking at a 7-county area around in the Scott, Sebastian, Crawford, Franklin, Johnson, Logan County area, Pope, Yell County, this area there. And so we also know that in this area, there are limited local health units and or VFC providers for families to get access. And so we think that being able to provide it where the children are at the daycare so that families don't have to take off work, or if they're having to schedule appointments and they're not able to get in with physicians, this would make it an easier method for them to be able to access those childhood immunizations. And of course, we want to be able to provide access to all areas. And so if there is a need in other areas within the state, we're happy to be able to work with you as well, but we're specifically targeting those areas in the western portion of the state where we see the VFC local health unit providers are limited. And there's also been a decrease in uptake for vaccinations. And so if anyone has any questions about the opportunity to work with you, I'm happy to answer those. I will drop my contact information into the chat so that you will have that and be able to reach me directly. And again, appreciate the opportunity for being able to be included in the agenda today, Tanya, to talk with you all.
Thank you so much, Rhonda, and thank you for all you're doing to help keep our children safe. We appreciate the opportunity. And so you have, you'll have Sharonda's contact information so that you can reach out to her if you're interested in having every one of those areas that they are trying to really help get immunizations up for children that may not have those. I just wanted to clarify, I saw a couple of things about the billing and questions. Just a reminder, if you have billed and you're not in Benton, Washington County, it is probably not a problem unless you notice the rate was wrong. If you're in Benton or Washington County and you billed, we'll work with you to get everything corrected. But if you're in other parts of the state, it's probably not a problem for you and your billing will go through. Once we suspend, and that suspension I sent about an hour ago or maybe half an hour ago. So it will just temporarily be down. And as soon as they are able to make sure that everything is correct and the rates are correct, they will open it back up. So we'll post something on the billing website and we'll keep you updated through that for those of you who are billing for vouchers. So it's just some of the glitches as we transition into new technology. All of our systems really work together. And unfortunately, the licensing system is having some difficulty talking to the billing system, and it's causing that problem. So we are working on it. We are aware. And thank you to all of you who are reaching out when you do see a problem and letting us know. That helps us immediately get on it and try to get it corrected for you. I think our next person is about the new system. So I will hand it over. I don't know if that's Dawn or one of the licensing staff.
Tanya, this is Dawn. So good morning, everybody. So rolled out the new system Monday. And out of all the providers we only have about 186 who have not created their account, which is like 90%, which I think is amazing. That's just amazing that you have worked so hard to get an account. What we're going to do after I finish is Becky's going to give you a couple of slides that kind of walk you through how to get in the system now that it's up and running. We know there's glitches. It's a brand spanking new system. We've worked on it for about a year. I really had no idea what was into creating a new system. You will be able to see your visits. You'll be able to put your license fee on. There'll be so many things. You can make a incident. You can do a holiday. There'll be so many things you can do on this new system that you had to go somewhere else before. So it is up and running. What we're going to do today, give you 2 slides. And then I think after next week, when things kind of settle down a little bit more and we know everything's running smooth, we're going to just try to make a video that just walks you through, this is what you do in the life of a provider. This is how you go in. But right now, if you have signed up, you have your account, you should be able to go in right now and at least see, make sure your rates are right, make sure your address is right, just things that if you've had any changes in the last few weeks, because what we did is we took everything that, all of the information that was in class, and we rolled it over into this new system. So if you've changes in the last few weeks or in the last month and you had not updated, this would be a great time to do that. And then next week, we're going to try to make some just short videos that say, this is how you look at a 521. This is how you file a complaint, things like that. So I'm going to turn it over to Becky. She is going to walk you through just making sure your account. I just want to say again, 186 providers is all we have left that haven't signed in. That is just an amazing. They were hoping if we just get 50%, we would be doing good. So to have that many people is absolutely amazing. I'll drop my email in the chat box too. And if you have any questions, you can reach out to me. And if I don't know the answer, I will find somebody who does. And so Becky, she's going to kind of walk you through the provider login.
Hey guys out there, I guess I'm going to start with that email address, and you should have gotten that email address in your email when you got the access to it. But this is when you're going to want to bookmark, because you're going to want to make sure that you get to this portal a lot so you can do everything that you need to do. For you guys, I know I've gotten a lot of calls to be like, I don't even know what my username is. Well, your username is going to be that same email address that you use to create your account. If you had somebody else create that account for you, because I know many of you got multiple facilities out there, just find who created that account and let them log in with that email address. If you're one of those 180 or so that didn't get that account created, or if you know somebody who falls into that boat, they're not out. They can still get into this system. They're going to use that same link at the top there, and then they're just going to click on provider login, which is where you're going to click as well. And then it will go to that next screen where you enter in your username and your password. At the very bottom, there's a button there that says not member. So that's what they would click. Once you are in, you're going to just select where you're at. So you guys are all that child care licensing. You'll just hit that manage button. And then it comes up to this screen that's right down here on the bottom. And there's those three options that you've got. You can manage applications. So if you are one of those providers that's going to be creating starting up a new facility, you'll go there for that particular route. Manage facilities, that's where you're going to see all of your license reports. And then the one area that I know I work really closely with is that online payments. What's really awesome is you're going to be able to pay your license fees online now. So no more of that snail mail and mailing in your check. In fact, our finance team, if they're getting any more payments in the mail, they're going to be just sending those back out to you, because all child care license fees are going to be paid online. We do know that some people are just having some issues as you're trying to log in that first time. That's how it goes with any new system. I've got my contact information down there for you. Feel free to give me an email and I will see what I can do to help navigate you through it. We also have our IT department. They're on standby, and your licensing specialist is another good resource for you. I really want to strongly encourage you guys to go ahead and just get into this system and play with it this week for sure. We've got Deloitte, that company that built it for us. They are on standby this week. So if there are issues, we can get very quick results for you. So get in there, go ahead and play around with it. And if you've got troubles, I'm here for you. Just send me an email, give me a call, and I'll get you on the way.
Hey, Becky or Dawn, we do have a question from one of our providers, and I'm pretty sure the answer is yes, Mr. Schaefer, but can you have more than one person per business to have access to the system?
Dawn, do you know that? Do you want to answer that one?
Well, and right now, you have one person to set it up. Once you've got everything set up, then yes, I believe you can have more than one person. It's kind of like you just need to be really careful, because whoever has access to this will have access to all of your internet information. So I would just be very careful on you know, who I was giving access to. But yes, you should be able to. I would not try to do that this week. I would give it a week just because there's just so much going on. And then I see someone ask about the search engine. It is up. We have a new address. That should be up. That we brought that up yesterday, so that should be added. I hope it's added today. Is there directions to add someone? That will be on the video next week. I'm gonna make sure I add that to it. When I go to manage facilities, nothing is there. Sherry, let me reach out to you. Can you email me that? And I will get that question to Deloitte and make sure and put your license number in there too. And that way I can make sure to see. We had some last week that set up an account and then they went to look what last Friday accounts weren't there. So it's probably just something system. But it is brand spanking new. So we know there'll be a week or so that there will be things. But yeah, Sherry, you email me, make sure your license number's in there. And then I will make sure when we do our instructions that we show how to do adding extra people on.
I see that somebody, can you list your email? Dawn, if you're all right with it, go ahead and I'm going to put my email in there for any of those questions. I'll go ahead and just kind of navigate that stuff. So I've got Rebecca.Mitchell down there. I'll put it in the chat box though, so you guys, any issues, facilities aren't there, the password's not working, anything like that, I'll be there for you. And Dawn's right, we're going to be working on getting those trainings together for you. We'll get them out real soon.
Yes, it will not be a professional video. It will probably be me filming the back of Becky's head, but we will get you something. We just didn't try to do it today. We knew there'd be questions. Okay, so Dawn, pick them. I'll email that to Becky too. You should have the right facility if you set up an account. So yes, just send that to Becky too. And she'll, because Deloitte, like she said, is on site right now. We can get those questions straight to them and they'll be here all week.
And it looks like Tom Sheppard is up next.
Greetings, folks. We are winding down on the ARPA grants, getting close to the end of this process. As you'll see, the operational grants, the quality grants, and the expansion grants have now all closed. So if you have not already applied for those, it is too late. You'll not be allowed to apply for those. For those of you who have applied for expansion grants, they are still being reviewed. It's quite an extensive review process that we have to go through on those expansion grants, but we are reviewing those. It's just sustainability, I had a hard time saying that, sustainability grants are still open, and they're open until the funding runs out. So where we're at right now is we have obligated about 240 million, the 258 million that we have been allotted to by the federal government. So we only have about 18 million left. So I need to encourage once again, if you have not already applied for those sustainability grants, you need to get on the system and apply for those grants. Paige, if you're there, would you put your email in the chat box in case they have any questions about applying for this sustainability grant? If you want to make sure that they have a contact. Paige can't do it. She's out today. I'll put my email in there in just a second. Thank you, Nicole. Payments have been delayed on some of our operational quality and expansion grants due to some system issues that we had following the transfer over from the new year. But payments have started to be processed again this week. Once payments go through our system, I want you to understand that then they have to go through the ACES statewide system. And so even though you may see approved in your application, it takes sometimes up to 2 weeks for it to make its process through the ACES system, which we have no control over. So if you're seeing your grant as being approved and you've yet to receive your money, it is in that process of going through our ACES system. Round 1 of supply building grants are still being reviewed, and round 2 of the supply building grant closes on August the 15th. These are for new facilities who are not eligible to receive expansion grant funding due to opening up after March the 11th, or brand new facilities who are trying to open childcare facilities. I do want to alert you that these grants, the supply building grant, has to go through a legislative committee approval process. So even though we are reviewing those, we can't make any payments on any of those supply building grants until after they have gone through the legislative committee approval process. So you may get a letter saying that we reviewed your grant and it's okay on our end, but it still has to go through the legislative approval process. So that's where we are at on these grants. I am excited that we have reached the 240 million mark, and but I do recognize that that 18 million will go fast as people continue to apply for the sustainability grant. So please get your applications in as soon as possible. Thank you very much.
Okay, it looks like I'm up next with Better Beginnings. My name is Kelly Hilburn. I'm the program administrator for Better Beginnings. And I just wanted to give a quick update. We have 87 facilities left to move to level 2 by the end of the month. So that means just since about March, over 200 facilities have achieved level 2. So that's a tremendous number. Super proud of everyone that worked hard on that. And the other update is we do have, and I will drop in the chat box so you can click on it if you want to and navigate to the proposed rules. That email or the website address is there on the screen as well. We are moving forward with the next levels in Better Beginnings, levels 4, 5, and 6, and those proposed rules are out there on the website for everyone to see.
Thanks, Kelly. I see a couple of questions in the chat box, Tom, about payments going out for sustainability. If you can drop that in the chat box. And then next on our agenda is our Child and Adult Care Food Assistant Director, who's over Child Nutrition, Pam Burton, to talk about the CACFP application process.
Hi, everybody. First, I want to say for those of you who are not participating in the Child and Adult Care Food Program, I want to encourage you to please reach out to us if you're interested. The Child and Adult Care Food Program is a federal program that provides reimbursements for nutritious meals and snacks to eligible children and adults who are enrolled for care at participating child care centers, daycare homes, and adult daycare centers. So if you are interested in getting on the program, by all means, give us a call and we will walk you through the process. Wanted to let you know, for those of you who are on the program, the application period has opened, so you can now start completing your application. The checklist can be found in the Special Nutrition Program Resource Library. And if you have any problems finding that, you can reach out to our team here, or you can reach out to myself and we will guide you through the process on how to obtain that checklist. There are contact numbers listed here with Nora Fawcett, Sharon Hagen, or myself. If you have any other individuals that have daycare facilities or would like to be a part of the program, you can reach out to Teresa Taylor and she will get them information regarding our child and child care program. As well, we also wanted to let individuals know who are on our program. We currently have 4 national waivers that we are operating under. We understand that there are some challenges that are still apparent for entities right now. So USDA has created 4 national waivers that we have opted into for the Child and Adult Care Food Program. Those waivers are for sponsoring organizations, on-site monitoring visits, a non-congregate meal service waiver, a parent and guardian pickup waiver, and a meal service time waiver. If you want any information regarding any of this information, by all means, please reach out to me and we can get you any additional information that you will need. I will place my information in the chat. So when this rolls up, you'll still have my contact information. Thank you all, and I look forward to speaking to you all.
Thanks, Pam. Then next up is our next call. But before we go to that, just a couple of quick things that I thought of as we're going through, and then we'll take a last look through the questions chat box and make sure that we've responded to those. The rates, I just want to emphasize the rates for childcare. So now that we're going into the enterprise system, you will be able to go in. In the past, we worked with you and got your rates and our staff entered, but you will enter your own rates. I cannot emphasize enough the importance of putting the rates that you're charging in your community, and here is why. We do a market rate study that's required from the Child Care Development Block Grant. It's part of our plan submission. It's part of the state's requirement. And if you all do not update yours, then it can look like Arkansas charges less and our rates can be wrong. So if you update your rates and we do the rate study and it's reflected in the rate study, then we can see the actual cost, the actual amount that you're charging, you're paying parents. Is just really, really important to the block grant. And I just want to emphasize, as you get comfortable with the new enterprise system, go in there and look at your rates. The person who does our market rate, Dr. Lorraine McKelvey, is telling us in a meeting yesterday that she's looked and it doesn't look like any rates have been changed since 2019, or in general. I'm saying that generally, some of you probably have updated yours, but that is where we get the market rate information. Rather than calling you and bothering you, we pull it right off the system. But again, you will be able to update your own rate. So I encourage you, as you get yourself set up in the licensing system and go into your portal, that you look at your rates and make sure they are correct. And make sure you update them at whatever frequency you're changing the rates for your parents. If you're raising your rates, update your rates, because we're going to pull off at some point in the year to use for the market rate. And it really is critical to Arkansas for setting the child care assistance or voucher rates that we have. We raised those last year, but we're required to review that. So I just want to encourage you all as providers to do that. And then I also wanted to share, I got something from a colleague just really minutes before the call. And it is really about, it's 3 different national reports that have been used to look at all across the nation at factors for great early care and education programs and the best and the worst in the early education system. So it uses a report that the Department of Ed does for state-funded pre-K from the National Institute for Early Education Research called NEAR. It also uses a study, the Commission, Education Commission of the states, and then it also pulls something that's on the child care side, that's the National Women's Law Center. And so they took all of those 3 things and looked across the country and weighted early care and education. And I just have to share with you all that Arkansas is number 1 on the list. We are number 1. We are the number 1 state. It says the best early care and education system in the country. So I think that's huge. And I just want to share that with you all. I know there'll be some media. I know that Lori Bridges, my colleague at the Department of Ed, will be interviewed some. It has a lot to do with 3- and 4-year-old pre-K, but it also has to do with childcare and the rates and the fact that we don't have a waiting list and a lot of the things that we've been doing with the American Rescue Plan funding and other COVID funding. So you'll probably see that. I hope you'll take a moment to read it. I think that's exciting for Arkansas as a state. So I just wanted to make sure that you all knew that. I do see a few questions coming in. A question about the maximum amount of time a pre-K student can be in school. That's an interesting question. When you say school, I'm not sure what that is in reference to. Are you meaning school as in a public school, or do you mean in an early childhood program? Because I think of those two things sometimes in the same way. But if it's a school-based question, you know, it's whatever the school day is, that's the amount of time. If you're asking about from a childcare setting standpoint, that's between you and the parents. We pay for a full-time voucher. So I'm not really sure. I may need a little more information. If you want to reach out to me individually, I put my email in the chat box, or you're welcome to call me. I'll put my phone number in as well. I want to help you, but I'm not really exactly sure what that question is about. And then there's also a question in reference to the CCDF daily rate structure. The SN1, SN2, and SN3 rates, I believe those are the special need rates that we have for children who have a diagnosis and may need additional assistance in a classroom. We do pay above and beyond. We do have to have documentation for that. We do work with the provider to get that documentation. It could be a variety of different things that a child is needing, maybe even a one-on-one basis. Maybe they're having some behavioral issues and you could hire an aide or something. But those SN1, 2, and 3 rates refer to that. And it really refers to the 1, 2, and 3. It sounds like Better Beginnings. It's really about the severity. So SN1 would be a child that, you know, has some needs, but are not quite as severe as a child that has the SN3. So I hope I've got that right, staff. Please let me know if I need to correct anything on that. I can put, Danita, the NEAR website, I'm going to put it in the chat box for everyone to see. It is near.org. So I use it a lot for things. And again, shout out to my education colleagues, is they actually have a new report just specifically about pre-K in Arkansas, but the report I referenced is a little broader than that. And it includes the NEAR report as well as some other national reports that were used to calculate the best and worst states for early education. So, but there's the NEAR website. And when you go on their website, if you want to look at the annual preschool report, you'll see it as soon as you get there. You can look at a summary or each state individually. I think that is it, everyone. I apologize for the billing problems that we're having as a result of going live with our enterprise system, but we will be back on track, hopefully very shortly. And we're going to continue to monitor. Please let us know. I did see Tammy Rowland, your comment. Yes, we want to know any problems. I will tell you the childcare search is new. I too yesterday was looking for it and it does not look the same. I had a little moment of panic, but if there's a problem or concern with anything, we definitely want you to reach out. You can reach out to Dawn or Becky and let them know, and we'll get with our IT folks. But we want to know if there's a problem, whether it's billing or whether it's your license. As one of you pointed out, yours may be wrong or connecting to the wrong license facility. So we want to make sure we have everything correct in there. And we're just working through the hiccups. We went live over the weekend and transition. So please expect it can be a little bumpy at the beginning. Many of you remember regulatory checks. And if you'll remember, we have training now once a month to make sure that we have available to you all the opportunity to learn. That's up on the screen. The next call is September 6th. And then I do see a question. Do we know of any accredited programs for Arkansas Child Care Centers? There is, I think if I'm understanding your question, besides Better Beginnings or our quality rating and improvement system, which is required to take federal child care funds, there is national accreditation through the National Association for the Education of Young Children, and we do recognize that and do reciprocity. There is also for family child care, the National Association for Family Child Care. They have an accreditation program, which we also recognize. Head Start does their own reviews and uses a tool called CLASS. So those are some. There are also some programs related to early intervention called CARF. And I believe there's one other accrediting agency that they use, and those are more medical or health related type accreditations, but they do have some early childhood focus. So those are the ones that I know. We do recognize Montessori, so a Montessori program that's nationally recognized would also be included in that. So it's a great question. I'm going to close this out, gang. Everyone, we are at the beginning of August, and I know school is starting in a few weeks. So some of us will have some grandchildren and children starting kindergarten. Some of us will have new babies coming into early childhood. Just encourage everyone to take a breath and use your conscious discipline as we get these babies ready for all the learning that they're going to have the opportunity to do. We're all going to get through, and we're going to have a great year. And we're going to finish out the funding with American Rescue Plan Act for the stabilization. And then we've got the supplemental funds where you can access for Teach Scholarship and wage scholarships. And you can reach out to Paul Lazenby over at the Arkansas Early Childhood Association, and that will go through potentially 2024. So we'll still have some access. It's just going to look different than what Tom's team has been doing for the past really 3 years since 2020. Have a great rest of the week and a great start to the school year, and everybody be safe and well. And thank you all for everything you do for our babies and young children and school age kiddos across the state. Appreciate all of you.